Endometriosis is one of the ovarian dysfunction causes affecting women in their reproductive years and can result in infertility in up to 30% of women. One of the causes of endometriosis being high estrogen, low progesterone levels. Endometriosis, or the endometrium cells, are produced and should automatically shed with a woman's menses. In some women, they do not fully shed, and cells accumulate and create a lining in the endometrium lining of the uterus, and sometimes these cells travel outside of the uterus into the fallopian tubes, thus creating what we know as endometriosis. It's very painful, and it's been my experience in clinic that women experience extreme pelvic pain with their cycle, lower back pain, incredibly, it affects their mood enormously because it's very debilitating. And I have also come to see over the years that more and more women are exacerbating this condition in how they live their lives, particularly not resting during their menses, pushing their bodies too hard, exercising too hard, even in yoga practice, doing hard, strong yoga instead of gentle, restorative to really support the natural processes occurring in their body. Dr. Smita, how does Ayushakti treat endometriosis?
I've seen a remarkable result in endometriosis. In the beginning, this was like 20 years ago when I get to know people suffering from endometriosis. I was thinking that the cells are going outside the uterus lining, and how could you fix only giving herbs and detox and things like that? They can't get out of it except doing some surgical things. But the beauty of Ayurveda is that when you make a complete detox in the diet plan, it removes all the unnecessary things in wrong places naturally through body's own healing process. I want to share a remarkable experience of one American doctor, Kirsten. This Dr. Kirsten came to see me in America in 1995, and she had endometriosis which was removed laparoscopically 2 times. So she herself was doctor, and I'm very skeptical. But she came through somebody who had endometriosis and she got pregnant. So she said, okay, let me try. So she just came, and I immediately told her to come to India and do Infertox treatment. She stayed in our clinic for 6 weeks, did the complete treatment, followed the diet and everything. And I think in around 8 months, she didn't get pregnant yet, so she was wanting to know what's happening. She did the laparoscopy again, and she was completely surprised that endometriosis was gone. And then she got the baby after that.
Wonderful. Wonderful. So Dr. Smita, what is Infertox treatment?
So Infertox treatment is totally cleansing. So it begins with the anti-clogging treatment, and followed by removing of the toxins through purgation route, and then finally completed by giving specific enemas which are lubricating and moisturizing every organ, so that any organ which is sticking together in a wrong manner is separated. The mucous membrane around the uterus becomes more active, so it will definitely separate the endometrium cells which are stuck there, and then through some means of the body's own natural eliminating system, they just get out of the body. That's what I have seen in many, many hundreds of people.
Wonderful. And which herbs do you use?
We basically use definitely Suride, which is anti-blocking and good for hormone balancing as well. So it's general toning the hormones that will take care of the prevention of endometriosis, and balancing estrogen there. Then we gave also Granthiha and Uretone, which are anti-inflammatory and removes any clotting created because of the years of endometriosis. Because that itself creates kind of a tumor, because bleeding outside the uterus for many, many years, can cause a clot So it melts all the clots also. And this is how slowly and steadily, over a period of like 8 to 10 months, normally people get pregnant and they see the change in endometriosis.
Wonderful.
Yeah.
And diet specific to endometriosis.
Yeah, diet is always one most important thing in the diet is to take more anti-inflammatory food like vegetables, 70% of vegetables in the diet, broccoli, kale, spinach, zucchini, pumpkin, lauki, turai, padwar. All these vegetables are fantastic for any inflammation reduction. Then taking lots of protein also helps muscles to repair very fast. So 30% of the diet should be protein, including beans, mung bean, little bit of chicken and fish as well, lentils. All this protein should be 30%, and completely avoid inflammatory food like wheat, sour, fermented, or yogurt, red meat, or deep fried food. Should be completely avoided because that increases the inflammation, and endometriosis is a kind of a inflammation of endometrium cells.
Yes.
So it's important to avoid everything that increases inflammation.
This is wonderful.
Yeah.
Thank you.